name is Debbie Riva, and I am both a community member and an active licensed professional counselor. I was so pleased when HFA asked me to do this presentation on the topic of the fact that September is Suicide Prevention Month. It gives me an opportunity to speak about the topic, but it also gives me another opportunity to thank HFA for all the dedication and how much effort you guys have put into raising awareness of mental health concerns in our community. So there is so much we know about this topic. Heather has challenged me, and I decided to come up with the top 5 things that I think is really important for us to know about. And, the first one is this, that unfortunately, suicide is common. In the US, that's what we know. We know that it's the 12th leading cause of death for the US population. And then when you start trickling down to ages, we know that kids 10 to 12, 10 to 19, that's a third leading cause of death. I also think it's really important to know about how common it is to have thoughts of suicide. It's important for us to know how common it is, and so we can have a normalized discussion about it, and so that we're not also so frightened when these things and these thoughts creep up in our minds. And so we know that about 10% of people in the United States have had or are having thoughts of suicide. And what's really important for our community to know is that having a chronic condition, especially associated with pain, we know that's a significant risk factor. That is not saying that because we have a chronic condition, we're more likely to have thoughts of suicide or have plans to do so. It is just really important to know it's a risk factor. And we also have a lot of protective factors, which I'll tell you about a little bit later on. But it's important to note that it kind of makes sense that we as a whole, as a community member, are more at risk, because suicidality comes out of a couple of different things, and that is a life of chronic stress, and it also has to do with feeling alone and isolated. And so that's why it's important, especially important for us to be watching out for one another. And the second thing that's really important for us to know is that there is so much misinformation and downright myths about suicide. And I think this is probably something that needs a lot of clarification. Number one, the biggest one that I hear about all the time is the idea that if you talk about suicidality, or if you talk about suicide in general, that it's going to put that idea in somebody's head. I want you to know that's not only absolutely false, it's the opposite that's truth. That's true. And that is that when you have a conversation, what you've done is you've created space. You've created space for that person to tell you about what it's like to be in their emotional pain, and you created space for someone to feel seen. The third thing you really did was let somebody know that they're important and that you care about them. Here's another one. Once you're suicidal, once you're suicidal, you'll always be suicidal. Again, nothing further from the truth. We know that about 85 to 95% of people who have made an attempt, they go on to lead normal, fulfilling lives. It's just a short period when you look at it in terms of somebody's whole lifetime. The third thing is the most important thing for you to know, that there are warning signs about suicidality, and they're so important for us to know. But before I get into them, I really want to speak directly to anyone in our community who has lost a family member or a loved one, due to suicide. It is really, really common for people to blame themselves, just not in that moment, or really through the entirety of their lives, to blame themselves for not seeing the warning signs or not acting on them. But you have to keep something in mind. It's also very, very common for the person who feels suicidal to try to hide those symptoms from you. They have so many fears about what will happen if I talk about it. Or how will it impact you? Will you feel guilty, or will you feel ashamed of me? And the other thing is that, throughout speaking around the country, I've noticed that people who have lost someone in our community to suicide or really any other way, that all of a sudden they don't feel like they're a part of our community anymore. And again, there's nothing further from the truth. Everybody matters, and everybody has something to contribute. So let me go ahead and go to the third part of this, and that is the warning signs of suicide. Best way of doing this is just to kind of put things in silos. Look at what the person's talking about and what they're feeling and how they're behaving. Talking about, well, obviously, if someone's talking about wanting to die or the world might be a better place if I'm not here, if somebody is putting this on social media, something about feeling like they're a burden to others, has a lot to do with people feeling like they are shameful of themselves too, that there's something wrong with them. Here's the other part that you get really only from listening, and that is their feelings. It really is about someone that's feeling hopeless or trapped. It's someone that's just more than sad. They're also very agitated, or they're also very anxious. The most important thing to do is you wouldn't even know unless you had the conversation to understand how much pain that they're in. And then here's the part about behavior that we know. It is someone that's made a plan. It is someone who's automatically, or you begin to notice that they're withdrawing from family or withdrawing from community events. It's people that are taking some kind of risk that they normally didn't take. It can be something as simple as not complying with treatment as it comes to our community. The thing about it is with suicidality, when you're looking at behavior, you're looking at extremes. Is somebody's behavior changing, with no other cause to assign it to? And of course, whenever someone is using drugs or substances more, that's also an indication. One of the telltale signs that a lot of people know about is giving away their their possessions. So it's a lot of information, but HFA is going to post this too, somewhere what would give you like a one-stop place to look at the warning signs. Now, here's the topic number 4, having the conversation. This is extremely important for us to normalize the idea that it's okay to talk to someone about how they're really feeling. And it doesn't have to be as complicated as sometimes it's made out to be. It's something like, you know what? I really hear what you're going through seems painful and really complicated. And I might not have the answers, but I am here to listen to you. And I'll always be here for if you want someone to talk to. It can even be something like this. I'm so glad you told me that you're having thoughts of suicide. I want to hear more about what you're experiencing and what you're going through. Now, in terms of the conversation too, this is what we're taught. You really want to ask the person directly, are you having thoughts of suicide? If the person says yes, well, that's when you deep dive. Do you have a plan on how you would go about dying by suicide, and have you sought the means to do so? Again, this is really, really important to have this conversation without dread, where you are just having an open, non-judgmental space. And I can tell you that this works. There's a person by the name of Kevin Hines. He's one of the few surviving persons who jumped off the bridge of the Golden Gate Bridge in an attempt to suicide. And he said this: if just one person would have asked him the question, or would have noticed how much pain he was in, he said he would have decided not to carry out the plan. That's how important it is to have the conversation. The last thing I want to tell you about is about resources. And there's a plethora of resources out there, but the one that most people know about or need to know about, and that's a suicide prevention. That is the American Foundation of Suicide Prevention has a hotline, and it is 3 numbers, 988. You can call them, you can chat, you can text them. And what it is, there's trained professionals there to listen to you, and they know how to de-escalate you and also how to help you feel heard, and more importantly, to help you find the other resources. You also want to be aware of the JED Foundation. That's JED Foundation. This is an organization that's dedicated to preventing the suicidality of our adolescents and our young adults. And again, they have a special line too for you to call. And the third one is sometimes people don't feel comfortable talking to another person. So there's a crisis text line. You just text the word home to 741 741. And I think the best resource that I would be remiss not to talk about, and that is you and me, our community, our chapters, our national organizations. It really just takes one person to pause and notice somebody else's pain and be that person to create the space so people can feel heard and listened to and cared for. So with that, I would really like to thank once again Hemophilia Federation of America. They have spent so much time and so many resources to make sure that we know that having a bleeding disorder is more than our physical bodies. It's also our whole selves. So thank you to HFA, and I hope whoever needs to hear this, you have been reached and you've been listened to. Thank you.